I'll give a little bit of a focus on what we do with Professor Mohamed regarding the role of atrial fibrillation ablation in heart failure. I'll start. It's always good to start with a real-life case. So this is a man that I've seen about 5 months ago. He's 60 years old, had been hypertensive for quite a long time, and he presented with very advanced heart failure symptoms to the hospital after he had an episode of atrial fibrillation. While 2 weeks before his admission, his ejection fraction was about 55%, severely dropped the atrial fibrillation to 20%. And it took us some time to actually control that atrial fibrillation to about 1 week of another one in order for the cardioversion to be successful. So this does not come as a surprise or an uncommon scenario. It's actually a very common scenario to have patients with heart failure and atrial fibrillation. And this has been predicted by Eugene Bromwood back in 1998 when they were asked what would be the diseases of the 21st century. And he mentioned there will be 2 epidemics in the cardiology. One is the heart failure and the other is the atrial fibrillation. And they actually go hand in hand. Atrial fibrillation begets heart failure and vice versa. About 40% of atrial fibrillation patients will present with heart failure. About 30% of heart failure patients will have atrial fibrillation. And those who have atrial fibrillation have a worse prognosis regarding the heart failure. And that's because they have a common etiology. If you are hypertensive, you're smoker, if you're diabetic, if you're old, you have inflammation, if you have obesity, if you have a genetic disposition, that will cause both heart failure and atrial fibrillation. And the electrical and mechanical modeling increases electrolytic and diastolic pressure, and vice versa. This causes the heart failure to worsen, and causes the AF to occur. And when we compare about best management of atrial fibrillation in patients with heart failure, we always think, should we hold catheter ablation management, treatment, or option to these patients as they are a bit more frail than our usual atrial fibrillation patient, or should we offer them ablation earlier? And this has been studied in many studies. I'll pass the Ghana study, which is our focus group, treating patients who had heart failure. And one of the first studies was done in 2013 in London, and it actually shows that these patients who had an early atrial fibrillation improved in regards to their VO2 and also regarding their BNP, life with heart failure questionnaires and 6-minute walk test. And this has also been repeated in many other studies, all small studies, but again, ejection fraction improves with ablation, 6-minute walk test improves with ablation, and BNP gets better with ablation. And most important study that we have regarding this way of management is the CASID-AF trial, and the CASID-AF has been published in the New Journal of Medicine in 2018, and it's one of the early studies that showed an improvement in death and over whether this is heart failure with deaths or overall death when we offer the patient this ablation for the AF in comparison to just medical treatment. And this has also been reconfirmed with the most advanced heart failure patients, the ones that need something. I should not offer them an ablation because I'm worried about having a prolonged procedure or a complex procedure. For example, these are knee function class 4 patients awaiting heart transplant, and this is the CASID-HTX study. And again, the ablation significantly improved their outcomes. should be considered for most patients with heart failure. So if you go back, so what are the treatment options? And all are available in Egypt, and very soon all of them are I think they are already all available in other African countries, which are the radio frequency ablation, which is the classic way, and there's also the cryoablation, which is cuts the procedure time a little bit shorter and does not require a long learning curve. But then the real game changer is the pulse field ablation, which really cuts the procedure time from a 4-hour procedure to maybe an hour and a half procedure that does not require significant or deep anesthesia. So it can be done for more critical patients safely and in a shorter time. And this is what we actually offer to my patient. And we offer him the PFA, and he has done it, and now he's